Hello dear friends, welcome in Pharmaceutical Chemistry 2. Today we are going to deal with non-steroidal anti-inflammatory drugs. Myself Mrs. Urmila Ravindra Gowdi, MPharm in Quality Assurance and lecturer in KK Institute of Pharmacy, Chandori, Nasik. Let's start with the topic. The drugs which are used to reduce inflammation and pain arises from it are called anti-inflammatory agents. They are used in inflammatory conditions like arthritis, rheumatism, rheumatoid arthritis, ankylosing spondylitis, and they are also useful during headache, migraine, neuralgia, toothache, and dysmenorrhea. Now let's start with classification. It is broadly classified into salicylic acid derivative, for example aspirin. Then N-aryl anthranylic acid derivative or phenamates, for example mefenamic acid. Next class, indolyl or aryl acetic acid derivative, for example indomethacin. Indole derivative, ibuprofen aryl acetic acid derivative. And next class, pyrazole derivative, for example 5-pyrazolone 3-pyrazolene 5-1 derivative, for example analgin. Then pyrazolidine 3,5-dione, for example phenylbutazone, oxyphenbutazone. Now depending upon chemical property, the classification of NSAIDs is acidic compound, which again divided into aromatic carboxylic acid derivative, salicylic acid derivative, for example aspirin, and anthranylic acid derivative or phenamate, for example mefenamic acid. Next class, alkanoic acid derivative, for example acetic or enolic acid derivative, for example diclofenac. Then propanoic or prepanoic acid derivative, for example ibuprofen, and indole derivative, for example endomethacin. Next class, enolic acid, which again divided into pyrazolone, for example phenylbutazone, oxyphenbutazone. Then oxychems, for example pyroxicam, and benzotriazine, for example azapropazole. Second major class, non-acidic compound, for example proquazone. Now let's start with individual monograph. First drug, endomethacin. This is the structure of endomethacin, in which indole as a heterocyclic ring present in the structure, and the different group and linkage present on the indole heterocyclic ring are: at one position it has para-chlorobenzoyl group, at 2 position it has methyl group, at 3 position it has carbomethyl group, and at 5 position it has methoxy group. Therefore chemical name is 1-para-chlorobenzoyl 5-methoxy 3-methyl indole 3-eel acetic acid. Property: it occurs as a pale yellow or brownish yellow crystalline powder which is odorless and has bitter taste. It is very slightly soluble in water and sparingly soluble in alcohol. It shows polymorphism. When its alcoholic solution is treated with sodium hydroxide solution, it gives an on-standing deep yellow color which changes to greenish yellow and finally become pale yellow. Storage: it should be stored in well-closed light-resistant container. Uses: it is used to elevate the symptoms of rheumatoid arthritis, osteoarthritis, ankylosing spondylitis, acute gout, dysmenorrhea, acute musculoskeletal disorders such as fibrositis, lumbago, neck pain, myalgia, and pain in malignant disease. Dosage form: it is available in the form of endomethacin capsule, endomethacin suppository, and the brand names are Ciplacid, Endocap, and Endometh. Now next drug is ibuprofen. It is a propionic acid derivative in which para-isobutyl phenyl group is present at 2 Property: it occurs as white crystalline or white crystalline powder having characteristic odor. It is very slightly soluble in water but freely soluble in alcohol. It is soluble in aqueous solutions of alkali. Storage condition: it should be stored in tightly closed light resistant container. Uses: it is used to alleviate symptoms of rheumatoid arthritis, osteoarthritis, ankylosing spondylitis, dysmenorrhea, acute musculoskeletal disorders such as fibrositis, lumbago, neck pain, myalgia. Dosage form: ibuprofen tablet, and the brand names are Brufen, Ibugesic, Aciphen. Now next drug is phenylbutazone. This is the structure of phenylbutazone, in which it contains pyrazoline as a heterocyclic ring, in which at 1 and 2 position it has 2 phenyl group, at 4 position it has butyl group, and at 3 and 5 it has 2 oxo group. Therefore chemical name is 4N-butyl 1,2-diphenyl pyrazolidine 3,5-diones. Property: it occurs as white crystalline powder. It is odorless and is tasteless at first but has a bitter taste after taste. It is very slightly soluble in water, freely soluble in chloroform, and soluble in solutions of alkali hydroxide. Its solution in dilute alkali is hydrolyzed slowly and it is oxidized by atmospheric oxygen. Storage: it is stored in well-closed container. Uses: it is used to alleviate the symptoms of rheumatoid arthritis, osteoarthritis, ankylosing spondylitis, acute gout, pain in malignant disease, and it also used to treat rheumatic fever and superficial thrombophlebitis. Dosage form: it is available in the form of phenylbutazone tablet and phenylbutazone suppository. Brand names: Arcure, Butadex, Penyl, and Aristopyrene. Next drug is oxyphenbutazone. It is differ from phenylbutazone in having para-hydroxyphenyl group instead of phenyl group at 2 position. Property: it is white crystalline powder which is odorless and has bitter taste. It is very slightly soluble in water, freely soluble in alcohol, and soluble in alkali hydroxides. Storage: it should be stored in well-closed container. Uses: it is used to reduce, alleviate the symptoms of rheumatoid arthritis, osteoarthritis, ankylosing spondylitis, acute gout, pain in malignant disease. It is also used to treat rheumatic fever and superficial thrombophlebitis. Dosage form: it is available in the form of oxyphenbutazone tablet, oxyphenbutazone eye ointment, and the brand names are Oxalgin, Framer, Brugesic, and Inflazone. Thank you dear student for attending the session.